Hello everyone, welcome back. So next question, that is 36. Following are the causes of behavior problems among children except option A, parental factors, social relationship, family environment, physical health. So option D will be the correct answer, right? Clear? Because all other जो तीन बाकी है ना, parental, social and family environment, all are affecting the child, but physical health is not affecting. In case of adult, it will affect. Then for proper emotional development, which of the following is being avoided, right? So unhealthy criticism, unfavorable comparison, over domination on child's personality, and option D, all of the above. So see, in case of child, right, emotional development, what we are doing, unhealthy criticism means सबके सामने डांट दिया, unfavorable comparison means दूसरे बच्चों के साथ या दूसरे किसी के साथ कंपेयर किया, एंड ओवर डोमिनेशन ऑन चाइल्ड्स पर्सनालिटी, मतलब उसके इच्छा के ऊपर मतलब दखलदारी देना है ना, ओवर डोमिनेशन मतलब यही है. तो ये सारी चीज should be avoided. Okay, so all of the above will be the correct answer. Clear? What is the most important information the nurse teach to prevent relapse in a client with a psychiatric illness? Option A, develop a close support system, create a stress-free environment, refrain from activities that cause anxiety, follow the prescribed medication regimen. So what they have asked in question, see, most important information the nurse would teach to prevent relapse in a client with psychiatric illness, right? So create a stress-free environment, that will be a single best answer. Okay, so option B will be the correct answer. Relapse means recurrence of a disease or symptoms after a recovery. Stress beyond the mental capacity will cause a relapse of mental illness. That's why option B will be the correct answer. Multiple referrals between psychiatrists and other professionals is known as steering, ping-ponging, ganging and toting. So that is ping-ponging. What is that? It is an unethical practice of repeatedly passing a patient from one physician to another physician and again to a third party pair. So this is called basically an unethical practice of repeatedly passing a patient from one physician to another physician. Like that we also do, right? We have also seen in many sectors, right? That's why sometimes doctors are accused for this kind of unethical practice. Then sign of circle in family genogram indicate male, female, child and grandparents. So we know, right, that circle is female. So it will be option B. Family genogram is a family map or tree of 3 or more generations that records relationship, death, occupations and health and illness history. Sign of circle in genogram indicate female and square indicate male. So you can see these two. Okay. Draw family tree for 3 generations to do family assessment in community health practice is termed as. Now all you have studied, that is genogram. Okay. Now coming to which term refers to science that deals with promotion of mental health and prevention of mental illness through the application of psychiatry and psychology. मतलब क्या बोले हैं? Promotion of mental health and prevention of mental illness. Okay. So इसको क्या बोलते हैं? इसको mental hygiene बोलते हैं. Clear? It is termed as mental hygiene. It is a science developing and maintaining mental health and preventing mental illness. It refers to daily activities that support and maintain mental health. Temporary discharge of the patient from the psychiatric hospital is referred as parole, right? We know, we have studied. That is called parole. Very easy question, this one. Now coming to what is parole now? Parole is the temporary discharge of the patient from the psychiatric hospital to perform certain rituals or to attend certain family function. Abscond means leave the hospital without any information to hospital authority. So basically what is parole? मान लो किसी का शादी है ना, तो उसका भाई फैमिली में मतलब उसका भाई है जो साइकेट्रिक हॉस्पिटल में एडमिटेड विथ मान लो सीवियर डिप्रेशन. क्लियर? So now what we are doing, we are giving the permission to the patient to attend that vacation and also have to come back, okay, within the certain period. So that is called parole. Clear? Now number 44, a psychiatric patient is discharged by the concerned medical officer after their relatives furnish a bond along with an undertaking that mentally ill person shall be prevented from causing injury to self or others. Patient got discharged under which type of discharge? This is called under special circumstances. See, discharge patient under special circumstances में क्या है? Under this category discharge only the patient who was admitted under special circumstances after giving undertaking not to be injure self or others. Okay, so this is important one. By relatives or friends of mentally ill person to medical officer in charge of hospital. Okay, so this is called under special circumstances discharge. Okay. (45) The client whose admission is an involuntary admission is posted for ECT, electroconvulsive therapy. Okay. Based on this information, nurse determines informed consent not need to be obtained. Informed consent will obtained by physician. Informed consent needs to be obtained from the client. Physician will decide the need for informed consent. So basically it will be obtained from the client. Involuntary admission, admission of patient by application of mentally ill patient's relatives. Okay, legal guardian or friend on behalf of patient. मतलब इसमें क्या है, patient खुद से नहीं आए, उसका relatives या legal guardian जो है और friend उसके बिहाफ वो लोग आके एडमिशन करवाया. ठीक है. Then the admission is necessary when the mental ill person is dangerous for self or and others. Okay, and a client who is admitted involuntarily will also retain his or her right for informed consent. Okay, वो खुद का डिसीजन खुद ही लेंगे. Clear? Now coming to Mental Health Act was passed in which year? So that will be option C, 1987. It is a very important question as well. They have asked many times in question. Indian Mental Health Act passed by Parliament in 1987, which is an amendment of Indian Lunacy Act, that is 1912. And this act was finally drafted into January 1950 based on War Committee's recommendation and come into existence in all the state of Union territories from April 1993. Clear? Now it is replaced by latest Mental Health Care Act 2017, which obtained 14 chapter, right? No, this is 16. Clear? Chapter 5 contain rights of persons with mental illness and chapter 12 is admission, treatment and discharge. Okay, so you have to remember that. Now coming to next question, that is a client with a psychotic disorder refuses to bath or change her clothes. Which of the following interventions is congruent with the role of the nurse as a mother surrogate? Allow client to make decision about hygiene, assist client to bath and change clothes, encourage family members to talk to client, put client in private room to avoid offending others. No, that option B will be the correct answer. We will be assisting the client to take bath and to change clothes. Okay, a woman who through in vitro fertilization gives birth to a child into which she may not have genetic relationship called surrogate mother. We know, right? So here what they have asked, that's nurse as a mother surrogate. So first you have to know what is surrogate mother, right? There is no relation of genetical relation, right? Like no family relation is there. Okay, but a woman is giving birth in vitro fertilization. Now caring the patient like mother, example assist client to bath and change clothes, is the role of the nurse as a mother surrogate. Clear to all of you? Now 48, ability to understand self behavior and emotion is called judgment, intelligence, personality, insight. No, this is called insight. If you have studied in mental status examination, there also inside they have 6 marks, right? If patient is having lack of insight, that's why we are using that tool to know the insight of the patient. Clear? Now next question. The basic difference between psychosis and neurosis is clinical features, severity, insight, duration of illness. What is that? That will be insight. Basic difference between psychosis and neurosis is that insight patient in neurosis aware to reality and insight absent in psychosis, loss of touch with reality. Psychosis में क्या insight नहीं होगा, मतलब patient won't मतलब admit that he or she is having any problem. Okay, but जो neurosis में क्या है, insight is present. Yeah, that something is different from the earlier period that patient can realize, right? Sometimes they may not admit or they may not understand what is happening with him or her, but they have insight. Clear? But in psychosis they are like totally loss of touch with reality. Now number 50, in which condition the patient will have loss of touch with the reality. Now only we have studied, that is psychosis. The chief distinguishing feature of psychotic disorder is क्या है, देखो ऑप्शन, overwhelming anxiety, antisocial conduct, obsessive behavior, confusion between fantasy and reality. So that will be the correct answer, confusion between fantasy and reality. See, psychosis is defined as a gross impairment in reality testing, marked disturbance in personality with impaired functioning and presence of symptoms like delusion and hallucination. Chief distinguishing feature of psychotic disorder is the confusion between real and fantasy, not real, right? Due to absence of insight. Clear? Next is, what is the primary goal of community mental health nursing? Providing psychiatric hospital care, preventing mental disorders in community health, then diagnosing mental health condition, conducting research on mental health treatment. So basically our primary goal will be to prevent mental disorder in community setup, right? So that option B will be the correct answer. Primary goal of community health nursing is preventing mental illness and promoting and maintaining mental health in the people of community. Clear? Who proposed model of preventive psychiatry in community mental health nursing? N.N. Weik, Datta Ray, then Gerald Kaplan, Philip Pihal. Who is the proposer, right? Who has given the proposal? So option C will be the correct answer. You have to remember that anyway. Gerald Kaplan. In 1960, our psychiatrist Gerald Kaplan described level of prevention specific to mental disorder. There is a prevention model like level of primary, like primordial, primary, secondary and tertiary, same as the model. Okay, now coming to our next topic, that is therapeutic relationship and communication. That is basically a key elements in psychiatric nursing, right? Like nurse is the bridge between patient and doctor and other medical setup. So you have to be pro in building the communication, right? So that is the main point. So let's practice some important question as well. 54. An important aspect of nurse-patient relationship is option A, therapeutic, personal, social and casual. So option A will be the correct answer, that is therapeutic. There are various types of relationship like social, intimate between spouse, therapeutic. Okay, so total 3: social, intimate and therapeutic. Clear? Relationship between the nurse and patient should be therapeutic in nature. Making personal, social and causal relationship to patient is illegal. Okay, there should be only professional relationship with patient. Okay, now ongoing relationship between a therapist or nurse and a client or patient established to support clients patients therapeutic goals called therapeutic relationship. Okay, hope it is clear. The most important factor in a therapeutic relationship is trust, professionalism, knowledge and motivating. So obviously that will be trust. If you can't build trust between nurse and patient, so there will not be any effective therapeutic relationship and that patient won't trust you and won't tell anything to you. So that funda is that it is most important factor. See, rapport, trust, respect, genuineness, warmth and empathy, all these are important factors or components to establish nurse-patient therapeutic relationship. Now a nurse demonstrates caring, sincerity, empathy and trustworthiness, ethical nurse-patient interaction, emotional nurse-patient interaction, legal nurse-patient interaction, therapeutic nurse-patient interaction. So that is therapeutic nurse-patient interaction. Clear? All are the components of, right, that caring, sincerity, empathy, trustworthiness, all are the components of therapeutic relationship. So option D will be the correct answer. Which of the following would not promote trust in the nurse-patient relationship? What is that? Option A, fulfilling promises, maintaining confidentiality, returning at the stated time, examining wound without providing privacy. So obviously if you touch the patient without his consent, so basically in that case you can't build trust with the patient. So option D will be the correct answer. Okay, here you have to mark not because that will be changing the answer. Okay, you have to study the question carefully, then only you can answer correct answer. Trust can be demonstrated by nursing intervention that convey a sense of warmth and caring to the client. Activities that address the client's basic needs for physiological and psychological safety and security, that will improve trust. Clear?